Today we are going to have a lecture on the external carotid artery comes from a bigger artery which is called common carotid artery. Here we have in the lower half of the neck a big artery. This is called the common carotid artery. This artery bifurcates into two arteries, external carotid artery and internal carotid artery. This is the carotid bifurcation, where the common carotid divides into external and internal arteries. So we have three carotid arteries: common carotid artery, external and internal carotid arteries. The common carotid artery is present only in the lower half of the neck, the external and the internal carotid in the upper part of the neck. Why we call external and internal? The external carotid artery does not enter inside the cranial cavity because it gives all its branches outside. So you are going to find lots of branches for the external carotid artery in the neck here. And it ends outside here. At the end here, it ends here in this point. While the internal carotid artery goes inside the cranial cavity to supply the brain. It has lots of branches after entering the cranial cavity. It doesn't have any branch in the neck. The common carotid artery. If you look at the arch of the aorta, here are three branches. The first one is the brachiocephalic artery. The second is the left common carotid artery, which goes to supply the left side of the head and neck, and the left subclavian artery, which supplies the left upper limb. The brachiocephalic artery is only one. We don't have right and left brachiocephalic. It's only present in the right side, and it divides into the right common carotid and the right subclavian. The right common carotid goes to the right side of the head and neck, and the right subclavian supplies the right upper limb. So if I'll tell you what is the origin of the common carotid artery, the beginning, where does it begin? The right one begins from the brachiocephalic. It's one of the two terminal branches of the brachiocephalic artery, while the left common carotid is longer because it begins from the aortic arch. The beginning, the right common carotid is a branch of the brachiocephalic artery. The left common carotid arises from the arch of the aorta. This brachiocephalic artery, it has another name also, the innominate artery. The common carotid artery. This is the common carotid. It ends here by dividing into external and internal carotid arteries. It bifurcates at the level of the disc between the vertebra number C3 and C4, cervical vertebra number 3 and cervical vertebra number 4. So this is the ending of the common carotid artery. It ends opposite to the disc between 3 and 4 cervical vertebrae by giving two terminal branches, external and internal carotid arteries. So where the common carotid artery begins? It begins on the right side from the brachiocephalic, from the left side from the aortic arch. Where does it end? On both sides it ends at the same level. Either we say at the opposite the disc between cervical 3 and 4, or opposite to the upper border of this cartilage, opposite the upper border of the thyroid cartilage. This point also is the ending of the common carotid, and at the same time it is the beginning of the external and internal carotid. So now we are going to begin by discussing the external carotid artery. Each artery we are going to speak about. We have to know the beginning, we have to know the ending, we have to know the branches and the relations. So the external carotid artery is here, and this is the thyroid cartilage. Thyroid cartilage is the biggest cartilage present in the larynx. We call it Adam's apple, or in Arabic تفاحة Adam. So the upper level of this thyroid cartilage, this demarcates the beginning of the external carotid. We can also say the disc between cervical vertebra number 3 and number 4. So the external carotid artery begins opposite the upper border of the thyroid cartilage, or the disc between C3 and C4. As one of the two terminal branches of the common carotid artery. This is the beginning of the external carotid artery. Where does it begin? Where does it end, this artery? It ends here. It ends behind the neck of the mandible. You are going to see after a while that this artery here, it terminates by giving two branches. The first one goes upwards to the scalp, the second one goes forwards deep to the neck of the mandible in the infratemporal fossa. So the external carotid artery ends behind the neck of the mandible by dividing into superficial temporal artery and maxillary artery. The superficial temporal artery goes upwards, the maxillary artery goes forwards. What are the branches of the external carotid artery? We have 8 branches. I want to show you here, this is the external carotid. It begins here, it ends here, behind the neck, giving the superficial temporal and the maxillary artery. What are the structures here? This is the thyroid cartilage, this is the hyoid bone, this is the body of mandible, ramus of mandible, This is the digastric muscle. The digastric muscle has anterior belly, posterior belly, and intermediate tendon. What are the branches here? You can see lots of branches coming out here. 1, 2, 3, 4, 5, 6, 7, and number 8 from the medial side. We cannot see it from here. The first branch goes downwards. It arises from the anterior aspect of the artery. It is the superior thyroid artery. It goes to supply the thyroid gland. And we have taken this artery while we were taking the lecture of the thyroid gland. This is the superior thyroid from the anterior aspect of the external carotid. The second one is opposite to the hyoid bone, and it forms a loop upwards. This goes to supply the tongue. So this is called the lingual artery. The third branch, also from the anterior aspect, it goes to supply the face. So this is called the facial artery. Notice that the facial artery runs upwards, forwards, deep to the posterior belly of digastric. It enters this triangle. This is called the submandibular triangle, and it grooves the posterior part of the submandibular gland. Then it appears here at the base of the mandible, and it runs tortuously till the medial angle of the eye. So these three arteries, they arise from the anterior aspect of the external carotid. From the posterior aspect, we have two branches. The first one is the occipital artery. The occipital artery runs upwards and backwards along the inferior border of the posterior belly of digastric to supply the scalp. Number 5, posterior auricular artery. This passes upwards and backwards along the upper border of the posterior belly of digastric to supply the area of the scalp posterior to the auricle. So we have two arteries arising from the posterior aspect of the external carotid. We have also two terminal branches, superficial temporal, maxillary. Terminal means at the termination of the external carotid. So at the back of the neck of the mandible, the external carotid ends by dividing into superficial temporal to supply the scalp and maxillary to the infratemporal fossa. Note that the maxillary artery passes deep to the neck of the mandible, which means medial to the neck of the mandible. And we have taken the maxillary artery in details in the infratemporal fossa, and we have noticed that this artery is divided into three parts: mandibular, tracheoid, and pterygopalatine, and each part has 5 branches. The maxillary artery terminates by giving the infraorbital artery. The last branch from the external carotid, it's not the last actually, it is the first branch, but it arises from the medial side. It is very small branch and it ascends to supply the pharynx. It is called the ascending pharyngeal artery. So we have 8 branches from the external carotid artery. 3 from the anterior aspect, superior thyroid, lingual, facial. 2 from the posterior aspect, occipital, posterior auricular. 2 terminal branches, superficial temporal maxillary, and 1 from the medial side, ascending pharyngeal. So now we have finished the beginning of the artery, the ending of the external carotid artery, the branches of the external carotid artery. Now we are going to speak about the relations. There are some relations which are superficial to the artery. Superficial means lateral to the artery. And there are other structures medial or deep to the artery. From this photo or this diagram, you can see what are the structures superficial. In the middle here, we have this posterior belly of digastric. This is superficial to the external carotid. If you look at the upper part of the artery here, this part, we know that there is the parotid gland here. And the parotid gland contains 3 structures: the artery, vein, and a nerve. The artery is the most medial. If you look here, you are going to find the external carotid, and lateral to it or superficial to it, vein, and the most superficial is the nerve. What is the name of the vein? Retromandibular vein. What is the name of the nerve? Facial nerve. And these 3 structures are embedded inside the parotid. So the parotid gland surrounds the artery from every side. So it is superficial, deep, anterior, posterior. So, what are the superficial relations? Number 1, we have said the posterior belly of digastric muscle. 2, retromandibular parotid gland, retromandibular vein, facial nerve. If you look at the lower part here, you are going to find this nerve, the green nerve here. This nerve is the motor to the tongue. It is hypoglossal nerve. Cranial number 12. Also, there are 2 veins. Common facial vein, lingual vein. So you have 7 structures superficially related to the external carotid artery. Remember the number 7 in the relations. We are going to take 7 superficial relations and 7 deep relations. There are more than 7, but these are the most intimately related structures. The deep relations. This is the external carotid artery. This is the internal carotid artery. This is the part of the parotid gland. This is styloid process. It is a process from the base of the skull. and this muscle from the styloid to the tongue, styloglossus muscle. This muscle from the styloid process to the pharynx, stylopharyngeus muscle, with its nerve supply, glossopharyngeal nerve, cranium number 9. This is the vagus nerve. It is a very big nerve descending straight in the neck. It gives here pharyngeal nerve. It also gives another nerve to the larynx, superior laryngeal nerve. There are 6 structures between the external and the internal carotid artery. If we know these structures, they lie deep to the external carotid and they lie superficial to the internal carotid. What are these structures which lie between the external and the internal carotid arteries? Number 1, the parotid gland. Number 2, the styloid process. Number 3, the styloglossus muscle. Number 4, stylopharyngeus muscle with its nerve supply, glossopharyngeal nerve. The last structure between the 2 arteries. This is the pharyngeal branch of the vagus. These 6 structures, they lie between the 2 arteries. They are deep to the external carotid. Number 7, which is this structure here, it lies deep to both arteries. This is the superior laryngeal branch from the vagus. So, according to the relations, we have 7 deep relations to the external carotid artery. We have spoken before about the external carotid artery. This is to summarize what we have said: the beginning, ending, branches, and relations. Questions. What are the branches of the external carotid artery from its anterior aspect? We have 3 branches from the anterior aspect. What are they? From the anterior aspect, the first one is the superior thyroid, number 2 lingual, number 3 facial. The second question: write a short note on the lingual artery. We have said before, we must speak about the beginning, the ending, branches, relations. Do you remember the lingual artery? We have spoken about this in the lecture of the tongue. I'm going to summarize a little bit about this artery here. This is a little revision for the lingual artery. This is the external carotid. This is the lingual artery here. It makes a loop opposite the hyoid bone. Then it passes deep to the hyoglossus muscle, and after the hyoglossus muscle it passes upwards, forwards till the tip of the tongue. Opposite to the greater horn of hyoid bone, it forms a loop. It is divided into 3 parts. By which muscle? The hyoglossus muscle. Where is the first part? This is the first part before it reaches the muscle, the second part deep to the muscle, and the third part after the muscle. What about the branches of the lingual artery? From each part, we have a branch. So, from the first part, we have this branch which passes above the hyoid bone and superficial to the hyoglossus muscle. This is the suprahyoid artery. From the second part, which is deep to the hyoglossus, there is the branch which goes to the dorsum of the tongue. This is called dorsal lingual artery. They are usually 2 in number, dorsal lingual arteries. From the third part of the lingual artery, there is a branch that goes to supply the sublingual gland. This is called the sublingual branch. So we have 3 branches: suprahyoid, dorsal lingual, and sublingual. Another question: what are the branches of the facial artery? We know the facial artery is a branch from the external carotid anterior aspect, and we've seen it before, passing upwards, forwards, deep to the posterior belly of digastric, and is related to the submandibular gland, and it passes upwards tortuously in the face till the medial angle of the eye. What are the branches? Actually, the facial artery also has 8 branches, 4 of them in the cervical region, in the neck, and 4 in the face. What are the branches of the facial artery in the neck? This is the external carotid. This is the facial artery. It passes grooving the posterior aspect of the submandibular gland, passes upwards, and then it descends between the gland and the mandible, and then it passes upwards till the medial angle of the face. Here it gives branches in the neck before going into the face. The first branch ascends upwards to the palate. It supplies the palate. And if you go to the blood supply of the soft palate, you're going to see this branch. It's called the ascending palatine artery. The second branch goes to the palatine tonsil. It is tonsillar branch. The third goes to the gland. These are glandular branches. Number 4 is a branch that goes to the submental region. It is one of the contents of the submental triangle. This is called the submental branch. So these 4 are branches of the facial artery in the neck: ascending palatine, tonsillar, glandular, submental. What about the branch? These are the 4 branches of the facial artery in the face. Thank you.